The headlines are worrying.
Experts are warning it's likely to become a pandemic.
The number of people infected with coronavirus surged by more than 3,000 overnight.
As of early February, more than 20,000 people worldwide were infected with a new strain of coronavirus.
From the government who told us if you're staying inside, the chance of your survival is much bigger than if you go out. We are in history right now.
1 month after it was first discovered in Wuhan, China, the World Health Organization officially declared the outbreak a public health emergency.
We don't know what sort of damage this virus could do if it were to spread in a country with a weaker health system. We must act now to help countries prepare for that possibility.
A few days later, the U.S. also declared it a public health emergency and announced that foreign nationals who had traveled to China would be denied entry into the United States.
The president has signed a presidential proclamation using his authority pursuant to Section 212F of the Immigration and Nationality Act, temporarily suspending the entry into the United States of foreign nationals who pose a risk of transmitting the 2019 novel coronavirus.
Major airlines had already canceled flights to China. The global reaction to this novel coronavirus strain has been swift as the world tries to contain the spread of an entirely new virus.
It was a lot of unknowns in this. We saw this acceleration, which is now so obvious to everyone. You know, we started off with 25, 50, 100, several hundred, 1,000, 5,000, 10,000, and now 17,000. So we had no idea where it was going. The situation was such that we already saw that the introduction into our country was through travel-related cases. The other issue that was important is that the volume of people that were coming in daily from China, either directly or indirectly, where they would go from China to another country to the United States, was so high that it became logistically very difficult for the CDC to effectively and confidently screen people.
The coronavirus isn't the first global infectious disease to cause this type of panic. It most closely resembles the SARS epidemic that occurred in 2002 and 2003, which caused about 800 deaths in 17 countries, according to the World Health Organization. The difficulty of containing these outbreaks starts with how the disease is tracked and reported.
After SARS, the international health regulations were revised to say that if there's any unusual event related to health, it should be reported. So because of the IHR, China, when it discovered this new virus, reported it to the World Health Organization. And then they distributed that information to the rest of the world. And now each individual country is putting into place the measures for how they will be looking for it. We're seeing things like isolating patients in particular ways, putting travel restrictions into place, imposing quarantines. All of those sorts of actions are things that we learned from SARS.
But Chinese officials were slow to accurately report the new strain of coronavirus to its own people and to authorities, which could have aided in spreading the disease.
Really afraid that I will just get that disease because this is quite strong, and I feel that the government didn't help us enough, getting masks, stopping the patients from coming here.
The coronavirus is also unpredictable because it is an entirely new strain. Even though the flu has been a greater threat in the U.S., it is not easy to compare.
People say appropriately that, wait a minute, why are you taking such measures to address this new coronavirus when right here in the United States, we're in the middle of a flu season where there's 10,000 people have already died of flu and a lot more likely will. That the thing about flu, as much suffering and death it occurs every year on a seasonal basis, we have a very good experience and know exactly what flu is going to do. You can be guaranteed that as we get into March and April, flu will diminish and essentially get off the radar screen. Coronavirus is the unknown. We have no idea what its potential is the direction it's going or where it's going to end. And because of that unknown, it was felt that we needed to do something that in many respects was unprecedented.
The outbreak of this strain likely originated at a live animal market in Wuhan.
Lots of infectious diseases come from animals. It used to be that we blamed rats for just about every new infection. At the moment, we seem to be blaming bats for everything, because bats are what we think probably started the Ebola outbreak in West Africa. And we think that bats are a likely first host for this new coronavirus. So that's really typical. And we talk about new infections emerging at the human-environment interface, where humans are interacting with wildlife in perhaps a new way. But this doesn't just happen at animal markets in China. We can have new outbreaks happen on a farm in Iowa.
Even those who study and work on infectious diseases are unsure what will happen next.
This could mutate in a way that changes the way it behaves. If it mutates in some other way, it might become more contagious, it might become less contagious. It might cause less severe disease, it might change in the opposite direction. And as we get more data that come in, some of these initial characterizations of the disease may change a little bit.
Right now, the risk to the American public is low, but, big but, that could change because this is an evolving situation. And if it evolves into a true global pandemic, then we would have a very serious problem here in the United States.